Hi, my name's Claudia, and today I'm going to talk to you about the association between gestational weight loss in women with obesity and its impact on fetal growth. So first, as a bit of background, currently women with obesity deliberately try to lose weight during pregnancy, despite there being a lack of evidence to support this. Now, available studies on this topic are actually conflicting because some of them demonstrate an increased risk for small for gestational age neonates, whereas others do not. So we believe this is very important to investigate because of the high morbidity associated with having a small for gestational age neonate. Our objectives were first to describe the prevalence of gestational weight loss among women with obesity by severity, and our second goal was to examine the association between gestational weight loss and small for gestational age neonates, as well as large for gestational age neonates. And this again by obesity severity. So we conducted a population-based retrospective cohort study involving 89,835 women, where we got our data from Born, Ontario. We defined gestational weight loss as the net difference between maternal weight at delivery and the pre-pregnancy weight, and our primary outcomes were small for gestational age, or SGA, as well as large for gestational age, or LGA neonates. We conducted a multivariable log binomial regression model estimating the adjusted relative risk as well as the confidence intervals to determine the association between gestational weight loss and fetal growth by obesity severity. So here I'll bring you over to the results. In Table 1, we can see the obesity rates in Ontario pregnant women according to the obesity class. Which brings me to Figure 1 here. So Figure 1 is demonstrating the prevalence of gestational weight loss among women with obesity according to severity again. So here I'd like to bring your attention to the strong gradient between obesity class and the prevalence of gestational weight loss. For example, here for Class 5 obesity, out of all the women in Class 5 obesity, 14.9% of them lost weight, whereas only 3.7% of women in Class 1 obesity actually lost weight. In Figure 2, we can see the prevalence of small for gestational age and large for gestational age neonates out of the women who did lose weight, again by obesity severity. So if I run you through this figure, for example, here for Class 1 obesity women who lost weight, 13.1% of them actually led to a small for gestational age neonate. Now, let me bring you to the most important figure of the poster. So here, this actually summarizes the adjusted relative risk for the association between gestational weight loss with adverse outcomes. As you can see here, there's an increased risk for all classes of obesity in terms of getting a small for gestational age neonate, whereas there's a decreased risk of getting a larger gestational age neonate for classes 3 or greater, as well as overall. So this study showed the prevalence of gestational weight loss increases according to obesity severity in Ontario. It also demonstrated that compared to women with a recommended gestational weight gain, there's actually an increased risk of small for gestational age neonates in women who lost weight and a decreased risk for large for gestational age. We also saw that there's an increased risk for small for gestational age neonates for all obesity classes and a decreased risk for large for gestational age neonates in classes 3 or greater. And finally, further analyses will be conducted to control for confounding factors such as hypertension or placental issues that are often related with a high BMI, just to determine whether the increased risk in SGA can actually be fully attributed to the gestational weight loss. In conclusion, our study demonstrated that gestational weight loss in women with obesity was associated with an increased risk of SGA, and therefore it should not be recommended for women with obesity. Thank you.